the top crest of the hip, the belt line, the ischium is what you sit on, and the pubis is where the actual genitalia are located. Here is an anterior picture of this. Noting here, that is the location of the sacrum, and notice how it meets both sides of the hip. The sacrum is located posteriorly to the pubic symphysis, which is a darkened just for you to visually see. That does stretch during childbirth. The obturator foramen on the left is the holes where the muscles attach. The acetabulum to the left is very important. That is where the head of the femur articulates with for walking and movement. Now this is a posterior view. As you can see, the sacrum and the foramens. Remember, that's where the blood vessels and nerves enter through there. And let's now compare male and female pelvises. The female pelvis is smoother and lighter. It's less prominent muscles and ligaments there. Now the pelvic modifications are done for childbearing. The enlarged pelvic outlet is much more larger than males. The broad pubic angle is above 100 degrees. There's less curvature of the sacrum and the coccyx. It is wide in a circular pelvic inlet. Basically, all of this means that the pubic symphysis and the hip are able to stretch and dilate during childbirth. Let's look at this picture. On the left, you have a male hip. On the right, you have the female hip. As you can see, the female hips are much wider in a horizontal position. The male hip is less, and it's a little bit more stretched in a vertical position. So you can tell that the difference aids in childbearing. The lower limbs basically function to weight bear, meaning all the weight above the stomach to the head to the shoulders are all bearing down upon the hip to the lower limbs, allowing motion and for you to walk and run. All the bones of the lower limbs include the following: the femur, your patella, your tibia, your fibula, the tarsals, metatarsals, and phalanges. Basically all the bones below the belt line. The femur is basically the largest bone in the human body and is responsible for movement at the hip. The neck of it, as we said, along with the head, inserts into the acetabulum. It has some large landmarks known as the greater trochanter and the lesser trochanter, located at the top of the head. This is where tendons attach. The femur on the back posteriorly has this thing called the linea aspera. This is the most visible ridge or line that you can actually touch and feel. It's there so that the hip muscles can join there. It also has distal epiphysis known as the medial epicondyle and the lateral epicondyle. These are located right above the knee joint. The medial and the lateral condyle are separated by this thing called the intercondylar fossa. That is basically said a space where the kneecap can actually stay at the patellar surface. This is basically what forms your knee joint, this space in the fossa. Here's a picture of the femur on the left anteriorly, on the right posteriorly. As you can examine, you can take a pause of this video and please go over the words and the landmarks starting now. Okay, welcome back. I hope you had time to look at the anatomy of the femur. Again, at the top you have your neck, which inserts into the acetabulum of the hip. The neck is the extension to the head. You have the greater trochanter and the lesser trochanter, which are these landmarks above. The shaft is your diaphysis, or the middle meaty part of the long bone. At the bottom you have a patellar surface where the kneecap stays, lateral and medial epicondyle, which is more proximal, and the lateral and the medial condyle, which is more distal. The kneecap, also known as patella, is a sesamoid bone. It is held there by the tendons and the ligaments. It is located inside the quadriceps femoris tendon. The base of it attached to your quadriceps, and the top of it, or the apex, attaches to the patella ligament. It is a triangular yet circular bone, as you can see here. And this is a view from the top. So the patella on top is the anterior portion of your knee. As you see the condyles of the femur, that is very important to note. This is where a certain fibrocartilaginous meniscus sit upon. The meniscus, as you probably heard, are the actual padding which absorbs shock in your knee. When you run and walk, the meniscus prevents the condyles of the femur and those of the tibia from rubbing bone to bone. But as you get older, you lose the fluid, and that's how arthritis of the knee occurs. The tibia is known as your shin bone. It is the lower leg bone supporting a lot of the weight from the femur. It is much larger than the fibula and is located immediately, always, inside. It also has condyles, which inserts into the eminences of the knee. The tibial tuberosity. Let's make a note of this. This is a part of the bone anteriorly, superiorly, which is known to be the place where some people or young adults have what's called Osgood-Schlatter's disease. That is when the tibial tuberosity grows and calcifies and becomes swollen and inflamed, which causes a lot of pain when teenagers jump up and down in games like basketball or simple running. The tibial tuberosity is the area where the kneecap ligament helps attach it, and it's very palpable, or you can touch it for the most touchable part of the body of the knee. The tibia includes the shaft. It is quite protruding. You can actually feel the smoothness. It's mostly medially on most shafts of the anterior portion. The distal epiphysis becomes something known as the medial malleolus. Malleolus means little hammer, by the way, in Latin. And that's when you touch the bottom of your ankle, and if you invert or evert, you notice the bone that doesn't move from the ankle. That is the medial malleolus. The fibula is a smaller bone on the right side laterally, and it also helps attach the muscles to the feet and toes. It is much smaller than the tibia. It's almost like a long, skinny bone. It is located laterally, and it should create what's called, right here on this page, the lateral malleolus, which is opposite to the medial malleolus, and that's the most palpable or touchable bone on the outside lateral ankle. Let's look at these two bones down here. This kind of looks similar to the forearm bones for one reason. What's connecting them both? The interosseous membrane. So those two sections of the body or the limbs have that in common. This interosseous membrane in the middle is a webbing that connects both the bones. It does that in your forearm, it does that in your lower leg. From the top, you have, again, the medial and the lateral condyles. The tibial tuberosity is where the most pointed anterior portion is, where you can touch. The head of the femur is also palpable on the outside. You have your shaft of both bones, and on the bottom, which I feel is quite important, the medial malleolus. As you can see, that little dip, and also the lateral malleolus, another dip. That bottom section, the distal ankle, makes the joining connection between the lower leg and to the ankle, basically articulating with a bone called the talus. Pause this and please study the landmarks right now. Okay, I hope you've studied the landmarks of the lower leg. Let's continue. This is now a posterior version. If you wish to, pause this and study this as well. The ankle, also known as the tarsus or tarsal bones, they consist of the talus, which carries the weight from the tibia across. And basically the talus is the bridge between the lower leg to the ankle. Remember, the talus is the bridge. The calcaneus, which is the heel bone, transfers the majority of the weight from the talus into the ground. This attaches to what is known as the Achilles tendon. Achilles tendon, which is an extension from your gastrocnemius, which is your calf muscles. The calcaneus is one of the most overused bones of the foot. The cuboid articulates on the side with the calcaneus, and you have the navicular, which is located medially, and it is connected to the three cuneiform. The word cuneiform means wedge-shaped bones, and we'll see that in a second. There's a medial, intermediate, and a lateral cuneiform. Now we are looking at the top view of the foot. And as you can see from the top, the calcaneus is your large heel bone. The talus is the bone or the bridge. The cuboid is located on the outside laterally to stabilize the midsection. The navicular is on the medial above. And you have three cuneiform bones. The cuneiform bones are important because they connect to the main metatarsals 1, 2, and 3. Next, you have the 5 metatarsals, which make up the arch of your foot. Depending there how your bones form, you can be flat-footed, normal-footed, or high-arched foots. The phalanges are broken into 14 individual bones. On the left, you have your proximal, middle, and distal. That's 3. Notice that metatarsals 2, 3, 4, and 5 have 3 phalanges attached. However, metatarsal number 1 has only 2 located above it. And another name for a toe, the big toe, is known as the hallux. Again, the metatarsal bones, there are 5, number 1 through 4, medially to laterally, and it moves with your toes. The phalanges, again, there are 14 bones of the toe. The hallux, as we said, is the big or the great toe. Has only 2 metatarsals to it. I'm sorry, 2 phalanges attached. Other 4 toes include your distal, medial, and proximal landmarks. Here again is the picture. If you wish to study it, pause here now. Okay, welcome back. Let's move on. The arches of the feet, other than being flat-footed, normal, and high-arched, the longitudinal arch is basically how your foot is when it's moving from the calcaneus to the talar portion. Okay, the transverse is basically the curvature between the medial to the lateral. This is what it looks like. So a longitudinal, we're talking about from the back to the front of the toes. A transverse is from the middle or medial to the lateral side of your arches or metatarsals. A lot of people are born with different curvatures of the feet, and some people actually form different feet positions due to their body weight and how they walk and the shoes they wear. Studying the skeleton has revealed many characteristics: muscle strength and mass. Your medical history you can learn just from learning different conditions of the bones. Your sex and your age, bone measurements and fusion are told here. As children grow up, there's growth plates, which if fractured or broken can distort your height and your body growth. So it's important to know if you break a bone at a young age to see a doctor immediately. The following pages are going to show you differences in the sex bone creation of the male and female. So go ahead and study these and pause. And we're going to stop here because our next lesson will be this chapter, chapter 9. Thank you for joining us. See you in class.